Yeah, so we're primarily hospital-based. A majority of what we do is in the hospital, utilizing the cath labs, angio suites, and then the operating rooms. But vascular surgeons take care of all facets of the cardiovascular system, the specifically arterial problems, venous problems, and lymphatic problems. Think of it as we stay out of the head and stay out of the heart. Every other named blood vessel we can address.
Typically, we see patients that are older, 60 years old, 50, 60 and older. These are generally patients that are long-time smokers, maybe not. Diabetes is prevalent. Hyperlipidemia, elevated lipids in the bloodstream are prevalent. These are all factors that cause vascular disease, and also people with hypertension. In vascular surgery, the development of grafts, artificial grafts, also the use of the patient's own vein grafts, that was a big advance. More recently, we've got stent grafts now to fix aneurysms. So the technology is all relatively recent. The operations, even though we've been doing them for 40 years, we've gotten better and better. The tools have gotten finer, our technique has gotten better, the anesthesia has gotten better. So those are the types of things. And also the angiography, what we use to visualize the arteries, has also gotten a lot better. And now the big push is to things that are less invasive. So we're using, the best example is the stent grafts in the aorta to fix an aneurysm, which is an enlargement of an artery. The standard operation is to open the abdomen and replace the whole artery with a graft. Now we're able to slide a stent graft inside the arteries from small incisions and get the same result with fewer complications, lower hospital stay, and a lot easier on the patient.
One thing that's unique about vascular surgery is that when you develop a relationship with a patient, that relationship doesn't go away. Some specialties, you do one operation and you never see them again. We typically have a lifelong relationship with our patients, and that's what we love about it. But that's especially true with aortic repairs when we use these stent grafts. When your aneurysm is fixed with a endovascular device or a stent, that absolutely needs to be followed over time. And that too is done with ultrasound, the same type of test that may have found your aneurysm, or CAT scans. And the reason for that is the fix may have addressed the problem now, but again, the aorta can grow and change as the person ages. And so what can happen is someone could go on to develop leaks, where there's a leak of blood around where the original seal was. And that's how we detect those, is ultrasounds or CAT scans. Those leaks can then pressurize the aneurysm, and the aneurysm can then regrow. So it is very important that there is strict surveillance and follow-up to get these things addressed.